First thing that jumps out to me is his shoulders. That left
Um,
shoulder. Wowzers.
yeah, the right one jumps out to me more.
Really? Got a bigger arm window for sure.
Yes. And the rotation is following his arm. So it's like the
Mm,
arm is heavy and it's kind of taking the ball, the socket, the whole, like the right shoulder is sort of melting off a bit. The left one's very tight in the front, but well, let's just say this. Neither is good.
yeah, oh,
You know, you say potato, I say potato, but what we're looking at is an
he's
imbalance.
rotated big time.
He's rotated big time and he's locked down in rotation.
Yeah.
So he's like a bit of a strong person stuck in something. And yeah, let's check this out. We
And
know we see a hip hike, right? You see the hip hike.
yeah, left.
Left. So you got a left hip hike and a right shoulder that's lower, which is all compensation or crisscross,
Yeah.
right? His right to left patterning is off.
Yeah.
And it's off pretty strong. Look at the front pictures, right? Look at the belly button.
Hmm.
Look at the legs. And if people are having a hard time thinking about that, his quads are very tight. They're strong, they're developed. His calves are tight and they're spun into his body with a little external rotation. So we know his bum is tight or gluteus maximus.
Yeah.
He's got everything going on very tight and then he's rotated above. And his shoulders are locked in a rounded kyphotic position. And that's, I'd love to know what he gets up to all day with his body.
See something going on here.
Yeah, he's stuck in downward rotation of scapula, especially on the right side. He's more stuck because if you go highlight the same way you did with your box, so there we can see the scapula is winging a little bit, right? If you were an artist, there's a little bit of shading that goes down the midline and out, right? So we know that there's a little bit of a texture there. We go to the other side and it's flat.
Mm-hmm.
But it's flat in such a position that the tip of the scapula is moving towards his armpit, which is called protraction. And his is locked into a protraction. It'd be like if you were to go punch, but you got stuck there, but you brought your arm back, but that's still stuck. Kind of on both sides, but the right side is stuck. The left side is elevated.
Right. And he's got the puppy dog, a little something something there.
Right. Because the right side is pulling down. So sometimes when people are like, how should I think about my posture? Posture is relevant to gravity. So your posture is always about, are you getting pulled down?
Yeah.
Or are you going up against the gravitational pull? And that's when you see people who jump or just amazing athletes. They're usually the ones that know how to use gravity.
Right.
When you see a Shaolin monk run up a stick, but if you slow motion that down, you would watch his body twist and turn and his head would be leading it. His feet would be perching and it's all gravity. So this fellow here is more like the Leaning Tower of Pisa, right? He's gone to the right and he's just sort of over there. And I can only imagine he's got all sorts of stuff happening in his butt.
Yeah. Well,
There's just a lot going on in his butt. It's too tight.
He's reporting
forward.
He's reporting sciatica pain on the right side, so that makes sense. He's being pinched.
Yeah, pinched, torqued, twisted. I'd be curious what he does in his body all day. But you can see those are not the same, right? They look different heights even.
Yeah.
So there's something driving. He's got athletic hips driving, and then he's got the computer shoulders.
Now, what is this though? That's an
external rotation. That's his vasti medialis oblique. It's pretty strong on that side. You've just kind of got a visual of it. It could be something else on top of it, but that location, I think if you pull out, would be more of a shadow, unless he's got a cyst we don't know about.
Right.
but that's,
Too bad we can't see the feet,
it
but
looks a little shadowy. Yeah,
yeah,
but look at these down pictures. This is what's so very interesting. Let's go look at his sides.
not sides are the revealing part.
Right. So this is why I was saying he's
Look at
got
the
this
head. Oh my
crazy
gosh.
head forward position.
Oh,
So I do wonder if he's like, well, my first instinct is like, is he a cop, to be really honest? Or somebody in a military or something. It's not the haircut, it's actually the body, because I work with a lot of military people here because we're near the military. You guys might hear the planes overhead sometimes. And there's a lot of sitting, training, computer work, and then boot camp, but not so much as you get older, right? So there's this dichotomy of like the athlete from the belly button down and the computer warrior from above. I don't know. He could be a bicyclist too. He's got some interesting shapes of a bicycler because, again, it's that locked over position like a long road biker with a dominant right leg. Either way, he's tight in the hips. The hips are driving, and sciatica can come from the low back or the bum. We don't know. We would have to ask him. But man, if you got that head back over his spine and opened up the front of his body and unrotated him, he'd be really happy.
yeah. And
He would have gone to windmills.
he's not as bad as other people we see from the side here. His hip is
No, that's
not,
why I say he's sneaky. He's like an athlete from the belly button down.
yeah.
He's athletic. He has muscle tone. It's just you can tell he does one thing a lot. And I don't know what it is, but it has some strength in it. His legs are strong, right? So if we look at, he's a condition 1 with a very strong head forward.
Very strong head forward. And I
Very strong.
sympathize with that because I have it.
Well, but he's also got some tone. So
Look
that's
at
where
this.
I wonder what
This
is it?
sucks right here.
That sucks.
That sucks. That's not a fun
That's
life.
coming from his low back though.
Right. Yeah, he's got a flat back.
Yes, sir.
Oh,
But you have that too. Now check the other side. Right. So he's like a condition 3, condition 1, because he's got rotation. I guess I misspoke. That side's much more anterior.
huh.
He's real tight. That's why his right side's flat, hence sciatica. We keep saying he's pulled down, he's tight, he's compacted. This is somebody who needs to lift up against gravity.
It's just interesting because usually flat back goes with posterior pelvic tilt, but he looks like
his right. Open up a little bit more. Open it up a little bit more. That's why he has pain. Because if we wanted to really deeply look at the pelvis, I would have to go get the sciatic nerve done for you.
Yeah.
Inside of, there's your military. His glutes are very tight. Underneath the glutes are lateral rotators. Underneath that is your ligaments. Underneath that, so deep along his sacrum, he's got a lot of tightness, and that's pulling him into a posterior tilt on the right side. It doesn't look that much, but what we observe is the flat back. When we go to the left side, he's got more curve, but we also above saw he's rotated. So people, try to come in and they'll tell you things like, oh, my one hip goes back and my one hip goes forward. That's this guy.
Yeah.
So if that resonates with you, if someone's ever told you like, oh, your hips are different, his hips are different and he's strong. So we're going to assume it's a lot of muscle activity that's binding him.
Yeah.
More than, like, oh, he broke his hip. He could have, but you see what I mean? He's strong, tight, pulled down. That left hip is thrown out. That right one is just locked down like kryptonite.
Yeah.
Or like those bike locks that go clunk, clunk.
Right.
Tower, rotation.
So
Wall drops, gravity drops, things that
can
would really lengthen this gentleman and get his head back up for him would be
can you
helpful.
take us inside the body? Do you have anything over there?
I had what I do. I wasn't going to do sciatic, but I wonder if I could find it. If not, I can definitely show you the head forward. Let's see. Again, I feel like it's often. Do you see it? Are we there? All right. This is our gentleman. I catch myself in the computer. I highlight to you guys. You should really watch yourselves.
I got
It's
neck
so
pain just
easy to do.
watching this.
All right. So remember how I was saying he's protracted or kind of stuck.
Yeah.
This is all your trapezius, the middle girdle here. It's eccentrically loaded and tied. Okay. Why is that important? Eccentric is when the muscle goes into that more relaxed position. Concentric is when we contract. So in a head forward, shoulder rounded position, not only is the muscle in the weakest position possible, it's stuck there. So its recovery is ridiculous. And
Right.
I say that because it's tired. It's loaded, it's tired, it's tired. And look at, I'm sure everybody knows that place on their shoulder girdle where they're like, oh my God, what is that? That pain right there. Pull. That, remember I said his arm was just kind of hanging off of him. So if you pull one piece, you affect everything. Now, I'm not saying this guy sits like this all day, but I'm wondering, because his front, remember I was saying.
This animation illustrates the effect of tightness on posture.
Tightness on posture, tightness on posture. So if you sit poorly all day and then, there he is, there's our guy. There's our guy. Yep. It's just, that's it. Like, it's not, you have to put the head back on the body. That's the only way to fix it.
Yep.
Like, it's just what it is. You go from that to that.
Yep.
But most people do it poorly. They're like, oh, if I'm here, this is the answer. But it's not. It's a whole system. And if you look at the spine underneath, and a lot of people say, what's the posture? What's the posture? Notice the plumb line. It went through the ear. It went right through the shoulder joint. And that's interesting because a lot of people think the shoulder joint is further back. But it's where the collarbone meets the scapula, creates a joint, and then the bone floats in there. So every time you distort that pattern of that head forward, you take that joint right out of alignment.
Right.
And then we have pain. And then this gentleman stood up and he's tight and rotated because somewhere something's got to give. And for him, it's sciatica. It's his body saying, hello, please stop.
Yeah.
Hello, please stop. And after a while, he's
the red warning light.
Yes, sir. This is the other part that happens. These are fascial lines, okay? There's fascia, there's muscles, there's many, many different layers. This is the fascial line. When you distort anything up here, it affects this cross pattern in the front.
Yeah.
And that's how we get twisted. And remember, we saw on that gentleman, tight. Tight right in here. It was tighter. This was literally pulled down towards that hip. Right?
Yeah.
So when one side gets pulled down, the other side squishes out to the side. We get this squishing, we get knees squishing, we get things that squish. And then we get bulging, and then we get pain. Or in the sciatic position, they're squeezing onto a nerve that goes from your lumbar down through your butt, through your leg, all the way to your foot, and it can just radiate. And it's definitely a hypersensitivity to a shortening of some muscles that are pulling on some joints that are pulling on some nerves.
And I'd be willing to bet, and we'd have to run an N-ray with this gentleman, which is our nutritional exam. I'd be willing to bet he has soft tissue deficiencies. I'd be willing to bet.
Interesting. So, I would be so curious.
Sciatica, man.
Sciatica, and I've had it leave. I've had it come and go. To me, it's like a little, it just tells me when I've been sitting too much or if I'm twisted. I get it on the left side and I immediately just do a couple of I know what to do, just like all our clients will know what to do. Like I do an air bench, I do a static extension, I know what my body needs to unwind. And then it's like, oh, it's gone. Because it's like stepping on a hose when you step on a nerve.
Right.
It just gets squeezed, squished, ouch. But it cuts off the life force.
Yeah.
And
All right. So, I mean, we can get this guy corrected with some good nutrition, with some good postural therapy. I mean, this guy, and I bet you he would be a quick correction.
I'd love to see the function of his hips. I'd love to know if like he could do a hang.
Yeah.
I would love to see his hang.
Run some functional tests, see what's going on. Yeah.
Definitely.
All right. So
the pictures are great, but come talk to us. Come talk to us.
Anyone out there that wants their body evaluated, we can do a P-Ray for you. Peaceoverpain.com. We got P-Rays, we got N-Rays, we got rays of sunshine all over the place.